Hi everyone, this is Dr. Shabri Husur, the GP from Southwest of England, also the Medical Director of Adisha Health. In UK, temperature has dropped, the leaves are falling, autumn is here. The sunshine is a rarity. You guessed it right. So we are going to be talking about vitamin D and its supplementation. Vitamin D is important for the teeth, bone, and muscle health. It regulates the calcium and the phosphate levels in the body. Majority of it is produced in the skin with the help of the sunlight. Deficiency of it can cause thin bones in children called rickets and osteomalacia in adults. Small amounts of it is present in food which we eat, for example, liver, egg yolk, red meat, oily fishes like salmon, mackerel, herring, some fat spreads and fortified cereals. Yes, vegetarians, it is quite difficult to get vitamin D from their food. Just a small note, in UK, the cow's milk is not fortified with vitamin D. In the UK, because there is lack of sunlight, especially during autumn and winter, that is the months between September to March, Department of Health, to prevent people suffering with vitamin D deficiency, they give guidelines for vitamin D supplementation. So what do they say? Now, people are classified into at higher risk groups and people at slightly lower risk of developing vitamin D deficiency. So who are these people who are at high risk? Anyone who has got slightly darker skin, that is belonging to the ethnic minority, because the skin doesn't produce enough of vitamin D through sunlight. Example, Southeast Asians, Africans, Afro-Caribbeans. Any infants below the age of 1 year of age, if they are not drinking more than 500 mils of fortified milk, children between 1 to 4 years of age, or people who are frail, housebound, they are in a care home, they all belong to the high risk of developing vitamin D deficiency. So how much of vitamin D to take? Golden question. A little bit of maths behind this. 1 milligram is equal to 1000 micrograms. So the infants, they need just 8.5 micrograms of vitamin D daily. That's a tiny, tiny dose. Children between 1 to 4 years, they need 10 micrograms of vitamin D daily. People who are in the high risk group, they need 10 micrograms of vitamin D daily throughout the year. So that's throughout the year. People who are at lesser risk of developing vitamin D deficiency, they need 10 micrograms of vitamin D during autumn and winter months, that is between September to March. Couple of things, pregnant mothers and breastfeeding mothers can also take vitamin D. It is very safe. In fact, they should take it because of the increased demand of the body. You can speak to your community midwife or community pharmacist or your GP, and they will be able to advise you on that. If someone doesn't have vitamin D deficiency, which is proved with a blood test, in the NHS, the GPs are not allowed to issue a prescription for vitamin D supplementation. However, you can buy it over the counter. Most of the supermarkets, most of the pharmacies and health shops sell it for a very reasonable price. And if you have any questions, you can always ask the community pharmacist. I have got my vitamin D. I hope you've got yours. Thank you, everyone.